In turtles, the circulatory route taking blood to the arm and back could begin with deoxygenated blood in the sinus venosus, which would then enter the right atrium into the single ventricle and from there into the pulmonary trunk. The ventricle could possess a partial septum, which would help to separate the oxygenated and oxygenated blood, just not completely. From the common pulmonary artery or pulmonary trunk, blood could enter the left and right pulmonary arteries to the pulmonary capillaries where gas exchange would occur and the deoxygenated blood would become oxygenated. This oxygenated blood could return through pulmonary veins into the left atrium, into the single ventricle, into the ascending aorta, which would then enter subclavian arteries, but on the right side pass through a brachiocephalic trunk first. So this brachiocephalic trunk only exists on the right. From the subclavian artery, the blood would pass through the axillary artery to the brachial artery of the arm, and gas exchange could occur in the capillaries of the arm before the deoxygenated blood would be returned through the brachial vein, the axillary vein, the subclavian vein, into the left and right precava, or the anterior vena cava, before emptying into the sinus venosus. Here is the same route through the heart using closer images. The sinus venosus is the thin-walled chamber that receives deoxygenated blood that empties into the right atrium. The single ventricle shunts much of the deoxygenated blood into a common pulmonary artery or pulmonary trunk, into the left and right pulmonary arteries, which then travel to the lungs, so that gas exchange can occur in the pulmonary capillaries. Oxygenated blood returns in the left and right pulmonary veins into the left atrium, once again to the single ventricle, before being sent into the ascending aorta to the subclavian arteries, although on the right side there is a brachiocephalic trunk. From the subclavian arteries, blood then enters the axillary arteries and travels towards the arm.